think that a lot of these patients, they obviously in the position that they're in because they're procrastinating, right? So
Mhm.
it's almost that we need to understand how they think and what it is. Like our job is really to help them help themselves because their teeth are in the position that they are. Like, yesterday we met an unbelievable person and I said to her, why do you think that you're like this, that your teeth are so broken down? And she told me, she's like, when I was 10 years old, they came to my school, they did dentistry, they took teeth out, they did fillings with no anesthesia right there in the gym. And I
Oh my
stopped
God.
and I stopped going to the dentist since then. And it just gives you an idea a little bit about what is going through the patient's mind. So I think in general that they really want to do this and they obviously really need our help. But I think that on the initial phone call, if you don't give them that unbelievable experience, then they're just going to put you back into that position of like every other dentist, the dentist that hurt me, the dentist that lied to me, the dentist that didn't deliver for me. So you have to come up with some sort of reassurance because I don't think it's mostly about the money because I really truly don't believe that, especially the patients that make the appointments, right? The patients that make the appointments, it's like they know that it's going to cost some sort of money. How much it's going to cost, that I don't expect them to know. But they know it's going to cost some sort of money. And if we have the ability to enable them to help themselves with just saying one thing that touches them, to be like, we're going to be there for you. You don't need to worry. I always talk about, they say, I hope it turns out okay. They don't need to hope. And that's one of the things, like, you don't need to hope. This is what we do. We're going to help you. And the first step is showing up for your consultation. And almost to the point where your first step is showing up for the consultation. Can we make an agreement together that you'll do that for me and I'll make sure the doctor takes great care of you? And we're just having that small little, like, I'm going to do something for you. Can you do something for me? Because the problem is they don't even call. They just don't show up. That means that the relationship that you made with them on the phone is not strong enough for them to even call you to say, hey, I'm not coming in. I'm afraid.
Mhm.
It's not the right time. And that's also okay. They call to reschedule. That means that you've already made the first step that they feel they owe you something. But if they completely cancel without showing up, that means that the initial touch on the phone wasn't strong enough. The initial touch to just convince them to say, I'm going to do something for you, please. And it's not a lie. We do this for all the patients. But to
Mhm.
get that initial touch that they feel comfortable so that they know that you're different than everybody else, I think will make a big difference.